So, good evening, guys and girls. I hope all of you are doing fine. I'm Dr. Omkar Sangita Diliprasonone, and I welcome you all back to the session of Sparks. Today's session will be about part 2 of PSM revision and chanting. As all of you are quite aware that we had covered the part 1 yesterday. Today we'll be covering again the part 2. I know that you have been attending your medicine classes for a while now, so you are exhausted. So again, a shorter session for today. We'll discuss the remaining points from all the health programs of India and the health agencies or the important agencies of India that on which questions can be asked in the examination, right? So let's move on. And I hope you would be interactive in the session 2 as you were yesterday. Okay, because that really helps. Just a minute, let me open. So moving on with the session, so let's start. We yesterday left at Mission Indradhanush, right? So today we'll be starting from there itself. Please keep on answering in the chat box, guys. So now along with this Mission Indradhanush and all these, we also will discuss a very important topic of vaccination from PSM, on which questions have been repeatedly asked from PSM as well as from pediatrics. Okay, so let's start. Okay, so first of all we'll talk about Mission Indradhanush. This logo, which has 7 colors of a rainbow, okay, it is for your Mission Indradhanush, and you can see a child over here with a syringe in his hand. So please remember, this is the logo of your Mission Indradhanush. The tagline is "Be wise, get your child fully immunized." Okay, so this Mission Indradhanush was launched by the Ministry of Health and Family Welfare, Government of India. Okay, and what is the main aim of this Mission Indradhanush? So it includes 100% coverage for all the 11 vaccine preventable diseases. Previously there were 7, then 4 were added, so making it a total of 11 vaccine preventable diseases. In 11 वैक्सीन प्रिवेंटेबल डिसीजेस के लिए 100% इम्यूनाइजेशन कवर होना चाहिए इन इंडियन चिल्ड्रन. दैट इज द मेन एम और गोल बिहाइंड दिस मिशन इंद्रधनुष. एंड विच आर दीज 11 वैक्सीन प्रिवेंटेबल डिसीजेस? मे बी एक्सेप्शंस कैन बी आस्क्ड. ओके, सो यू नीड टू रिमेंबर दिस. सो फर्स्ट इज योर ट्यूबरकुलोसिस, सेकेंड इज योर पोलियो. पोलियो का ही एक और वैक्सीन है, दैट इज ओरल पोलियो वैक्सीन, एंड सेकेंड इज योर इंजेक्टेबल पोलियो वैक्सीन. राइट, याद रखना. Next one is your DPT vaccine, that is your diphtheria, pertussis and tetanus. Next is your hepatitis B, measles, rotavirus, rubella, Japanese encephalitis. Along with that there is pneumococcal conjugate vaccine and Haemophilus influenza type B, HIV. Okay, so all of these 11 vaccine preventable diseases are included under this Mission Indradhanush, in which by the year 2020 100% vaccination coverage was to be attained through catch-up campaigns, right? So this is the main aim of Mission Indradhanush. याद रख लेना. Okay, now let's discuss about the next image that we have over here, and the logo can be asked in the examination, and this logo is for the switch. Okay, the switch is a program. Okay, and the switch is a program which includes what? So in this switch actually we turn from trivalent OPV to bivalent OPV. So जो पहले पोलियो की वैक्सीन यूज होती थी ना, that was a trivalent polio vaccine. That was a trivalent oral polio vaccine which included P1, P2 and P3 strains of polio virus. But now, as we all know, that WHO has announced that P2 strain of polio has been eradicated from the world. Therefore, the newer bivalent OPV only contains P1 and P3 strain. So this can also be a question, which of the polio virus strain has been eradicated? So it is the P2 strain of the polio virus which has been declared eradicated. Okay, so the bivalent OPV only contains P1 and P3 strain of the polio virus. Okay, important one, please remember. So this was the switch program which was announced by the WHO, in which all the countries had to switch from tri to bivalent OPV. Okay, and the National Switch Day of India is observed on which day? So please remember, the National Switch Day of India was 25th of April 2016. National Switch Day of India was 25th of April 2016, when we changed from trivalent OPV to bivalent OPV. Okay, now here itself we'll discuss some few important points, guys, about our vaccination. So just be active in the chat box so that, okay. So now just tell me some important vaccine strains I'll be asking you. So सबसे पहले चलो tell me the vaccine strain used for measles. Which is the vaccine strain for measles? जल्दी बता देना. So I'll write 3 or 4 one and then you can answer it all of at a time. Okay. So measles का vaccine strain बता देना. Then BCG का vaccine strain बता दो. For yellow fever tell me the vaccine strain. Okay. Please tell me. These are the most important ones. Then for chickenpox also tell me the vaccine strain which is used. Okay. Also for rubella it is important, right? For rubella virus, for rubella vaccine, for mumps vaccine. Yes, very good, right? Yes, for measles, measles vaccine it is the Edmonstone Zagreb strain. Please remember it is your Edmonstone Zagreb strain. Okay, Zagreb strain which is used for measles virus. Yes, very good, measles vaccine के लिए. Then Danish 1331, not 1441. Please remember, correct yourself. It is your Danish 1331. 1331. Okay, Danish 1331 is for your BCG. B looks like 3, ऐसा याद रख लो. B थोड़ा बहुत 3 जैसा दिखता है, इसलिए Danish 1331. Okay, right? Important one. Yes, very good. Yellow fever के लिए it is your 17D strain. 17D for your yellow fever. Very good. Anybody else? Please type in the chat box, guys. Be interactive. जब आंसर दोगे तभी चीज़ें याद आएंगी. Very good. Yeah. Oka strain for chickenpox. Very good. Choka ऐसे याद रख लेना. Okay. C for chickenpox and Oka strain. So Choka ऐसे याद रख लेना. So chickenpox के लिए Choka, that is Oka strain. Yes. RA27/3 for rubella vaccine. RA27/3 important one. And mumps के लिए mumps छोटा सा नाम है इसलिए Geril Lin strain. Okay. याद रख लेना. Geril Lin strain for your mumps vaccine. याद रख लेना. These are the important vaccine strains that you need to remember. Along with that, there is a newer vaccine which is available for dengue now. Okay, that is known as Dengvaxia. क्या बोला जाता है उसको? Dengvaxia is available for dengue and that has the NS1 antigen strain. Okay, that has the NS1 antigen strain which is included in it. Okay, please remember this. Then moving further along with this, just remember for Japanese encephalitis. Okay, for Japanese encephalitis we have the Nakayama strain. We have the Nakayama strain for live Japanese encephalitis. Okay, याद रख लेना. For killed Japanese encephalitis which have been used in the national immunization schedule, we have SA 1414-2. Okay, SA 1414-2 याद रख लेना, ये important है. Then moving further to our next one, I'll discuss some more important points from vaccination. Okay, just we'll move on to the next slide first. Okay, ये जो image में दिख रहा है, what is this? This is your vaccine vial monitor. What does this signify? So first of all, this is a vaccine vial monitor. So जो vaccine की vials होती है ना, उस पे कुछ इस तरह के indicators लगे होते हैं. And what are these indicators telling us? So please remember, guys, these color-coded indicators, they'll tell us whether this vaccine can be used or it is to be discarded. ये vaccine use करी जा सकती है या उसको फेंक देना है. So this is the color indicator telling us. Okay. So please remember, there is a circle outside and an inner square inside, and this square inside has a lighter color. Okay, this square inside has a lighter color whenever the vaccine vial is packed. So याद रखना, whenever the inner square is light in color, or whenever the inner square is light in color as compared to the outer circle, then the vaccine can be used. Okay, so that the vaccine can be utilized properly. Okay, so whenever the inner square or the central square is lighter in color compared to the outer circle, the vaccine can be used. Okay, next one, if in stages 3 and 4 you can see, if the cold chain of the vaccine is not properly maintained, what happens is the inner square changes its color. Okay, if the color of the inner square is equal or darker than the outer circle, then the vaccine cannot be used. Then the vaccine should be discarded. Okay, so light inner circle, inner square का color अगर lighter है, vaccine can be used. Inner square का अगर color same या darker है, vaccine should be discarded. Okay, this is the basic phenomena और उस पे बहुत बार question पूछे गए just by giving these images. Okay, याद रख लेना. Now moving on to the next one, just before that, can anybody tell me, there are some diluents पे कभी कभार question आ जाते हैं, so just asking important diluents to you for vaccine. कुछ vaccines जो होती है, these are lyophilized vaccines, that is these vaccines are available in the powdered form, so these are to be mixed with some diluents. Okay, so can anybody tell me the diluent which is used for measles vaccine, Okay, please remember the diluent which is used for Japanese encephalitis vaccine and the diluent which is used for BCG vaccine. That is very much important. Okay, याद रख लेना, every country has its immunization schedule. Okay, and India also has its national immunization schedule. According to this, vaccines are given at birth, right? They are given at 6 weeks, then they are given at 10 weeks, then they are given at 14 weeks, then on 9th month, then between 16 to 24 months, right? And then at 5 years, then at 10 and 16 years, right? So 10 and 16 years पे कौन से देते हैं हम usually? Tetanus toxoids are given, right? So please remember 10 and 16 years पे we usually give tetanus toxoids. Yes, very good. Measles, it is distilled water, please remember. Okay, sterile or you can say distilled water, anything is fine. Sterile or distilled water is used for measles. Next one for BCG, yes, very good Sandeep, it is your normal saline which is being used for BCG. Anybody for Japanese encephalitis? So please remember for Japanese encephalitis it is your phosphate buffer saline. Okay, it is your phosphate buffer saline. Please remember this, phosphate buffer saline for your Japanese encephalitis vaccine. Okay, moving further now. Yeah, so please remember the national immunization schedule and they can ask you which 3 vaccines are given at birth. So याद रख लेना the 3 vaccines which are given at birth. First is your BCG vaccine, second is your hepatitis B vaccine, and third is your oral polio vaccine, OPV. Can anybody tell me the oral polio vaccine has 2 strains? Okay, it has a live strain and it has a kill strain. Live strain कौन सा है, kill strain कौन सा है, जल्दी से बता दो. Oral polio vaccine OPV, 2 बूंद जिंदगी के, right? So this oral polio vaccine has 2 strains, live strain and a kill strain. Just tell me the live and the kill strain. Live strain कौन सा है of OPV? The live strain of OPV. Please tell me in the chat box the live strain of OPV, guys. So please remember the live strain of OPV. Yes, very good Diamond. So live में आया आता है और Sabin में भी आया आता है, तो इस तरह से याद रख लो. So the live strain is Sabin, whereas kill strain is Salk. Salk ends with K, therefore the kill strain would be Salk. Killed is Salk and live is Sabin. Very good, guys. Now moving further to our next one, and that is our cold chains. Okay, so we'll talk about cold chains now. Cold chain is very much important, guys. तो cold chain क्या होता है? We need to maintain the temperature of the vaccine vials, otherwise उनका वो जो color होगा वो change हो जाएगा squares का, and therefore the vaccine should be discarded, right? The vaccines would be of no use. Therefore the cold chain should be maintained for these vaccines from the time of manufacture till the time of administration. This cold chain is to be maintained throughout the healthcare system, throughout transportation, all of it. Right, so please remember for this cold chain maintenance we have various levels. Okay, so याद रख लेना, सबसे पहले अगर हम बात करें at the state or regional level, please remember guys, at the state or regional level we usually have walk-in cold rooms. Okay, walk-in cold rooms जिसका टेम्परेचर होता है +2 to +8 degree Celsius, +2 to +8 degree Celsius, whereas we have walk-in freezers also, and these walk-in freezers have a temperature of -20 to -40 degrees centigrade. Okay, at these temperatures some of the vaccines like oral polio vaccines can be stored. Okay, so please remember yellow fever oral polio vaccine can be stored at these low temperatures also. Then after state or regional level उसके नीचे की level कौन सी होगी? So there would be district level you can say, or you can say CHC level, right? So community health centers और CHC level पे please remember we have large ILRs. क्या होते हैं हमारे पास? Large ILRs होते हैं, that is ice lined refrigerators, or we have deep freezers. Again, freezers would have the same temperature like -20 to -40, and ILRs would have the temperatures as cold rooms, that is +2 to +8 degrees Celsius. Please remember. Then at the level of PHC we have this one जो image में दिख रहा है ना, that instrument we have at the level of PHC. Okay, this instrument is located at the level of PHC, primary health center पे. So this is a ice lined refrigerator. What is this? This is a ILR or a ice lined refrigerator. Okay, temperature कितना maintain होता है? The temperature maintained in this is +2 to +8 degrees centigrade. +2 to +8 degrees Celsius is the temperature, right? It is for storage of vaccines. Okay, and the temperature is recorded twice a day. Okay, PHC पे कौन सा healthcare worker होता है? So please remember at PHC the healthcare worker is known as health assistant. one health assistant male and one health assistant female is located at the PSC level. So जो health assistant होता है, he records the temperature of ILR twice a day, उसका ये काम होता है, and the temperature is recorded with the help of these two instruments. ये कौन सी दो instruments है? First is your dial thermometer, ये जो ऊपर वाला दिख रहा है ना, that is a WHO और UNICEF standardized thermometer known as a dial thermometer बोला जाता है इसको. Okay, please remember dial thermometer. Whereas the next one, this is a alcohol stem thermometer. ये जो नीचे वाली इमेज में दिख रहा है, this is a alcohol stem thermometer, but please remember the preferred one is this dial thermometer, which is used usually to record temperature, right? Can anybody tell me now that minimum how much duration of electricity is required for this ILR per day? How much duration of electricity is required by this ILR per day? And without electricity, maximum it can maintain temperature up to how many days? Maximum it can maintain temperature up to how many days? ये दोनों क्वेश्चन के आंसर्स बता दो. मिनिमम कितने आवर्स की इलेक्ट्रिसिटी चाहिए इसको? मिनिमम हाउ मेनी आवर्स ऑफ इलेक्ट्रिसिटी इज रिक्वायर्ड बाय दिस ILR? And without electricity it can sustain or maintain temperature up to how many days? Yes, very good, Diamond. It requires minimum 8 hours of electricity per day. It requires minimum 8 hours of electricity per day, whereas maximum it can maintain the temperature without electricity up to how many days? Up to 5 days. Very good, Sandeep. So it is your 5 days. Maximum it can maintain the temperature up to 5 days without providing electricity, because rural areas में जहाँ PSCs होते हैं, usually there is a lot of issue of electricity, right? So the ILR should be able to maintain the temperature. नहीं तो बहुत सारी vaccines खराब हो जाएगी, right? Important one. Okay, understood? And now after PSC उसके नीचे की level कौन सी होती है? So please remember it is your sub center or village level, right? उसके नीचे आता है sub centers and then your village level. So at the level of sub centers or villages, we usually have these vaccine carriers. ये जो blue box दिख रहा है ना, so these are your vaccine carriers. See, they contain 4 ice packs. उसमें कितने ice packs रखने की जगह होती है? They usually contain 4 ice packs can be stored. Along with that, 16 to 20 vaccine vials can be carried in this. 16 to 20 number पूछा जाता है. Please remember it has been asked previously. So please remember how many vaccine vials can be carried in a vaccine carrier. So 16 to 20 vaccine vials can be carried in a vaccine carrier. And how many ice packs? 4 ice packs are carried. Please remember. And it is located at the sub center or village level. Now this ice pack. So ये ice pack ऐसा दिखता है, देख लो. Okay, जो ऊपर वाली इमेज में दिख रहा है. So this is your ice pack. Please remember, ice pack is the smallest component of the cold chain. Okay, ice pack is the smallest component of the cold chain. It can only hold up to 2 vaccine vials. इसमें बस 2 vaccine vials रखी जा सकती है, right? And it is used at the level of sub-center and villages again. And most important, that maximum failure chances are at the ice pack level, right? Maximum failure chances क्या होंगे? Ice pack पे, because it cannot maintain temperature properly, right? Then at vaccine carrier level, right? So in दो levels पे maximum failure chances होते हैं of cold chain. So please remember, maximum failure chances in cold chain are seen at sub center or below, that is sub center and village level. Okay, important, please remember this. Now can anybody tell me what is the reverse cold chain? याद रखना, reverse cold chain का भी temperature same होता है, that is +2 to +8 degree centigrade. +2 to +8 degree centigrade से temperature होता है. So can anybody tell me why? Where is the reverse cold chain practice? Important question. So can anybody tell me where is the reverse cold chain practice? So vaccines are going from the community. Now when the some sample would come from community to the healthcare system or the hospital, it would be known as a reverse cold chain. So your reverse cold chain is done for what? Can anybody tell? So please remember this, reverse cold chain is for your polio stool sample. Okay, so please remember, as we all know, surveillance is being carried out by the healthcare system for polio, right? और surveillance में क्या करते हैं usually? We have a surveillance method for acute flaccid paralysis in less than 5-year age group children, right? Yes, very good. So please remember, 5 साल के नीचे के जो बच्चे हैं, less than 5-year-old children, we see for acute flaccid paralysis. And when we encounter acute flaccid paralysis in these children, the healthcare worker or the doctor collects the stool sample, and this stool sample is sent to the laboratory in this reverse cold chain. याद रख लेना, okay? Important one. Yeah. TB sputum टेस्ट में नहीं करा जाता. TB sputum टेस्ट में टेम्परेचर की कोई ज़रूरत नहीं होती है. You can directly send the sputum sample, okay? So please remember, yes, it is in the National Polio Elimination Program. Very good guys. Okay, moving further, याद रख लेना screening क्या है पोलियो के लिए. It is your acute flaccid paralysis in less than 5-year-old children. याद रख लेना, right? And polio has been declared eliminated from India, right? याद रखना, कंट्री से कोई भी डिसीज एलिमिनेट होता है, वर्ल्ड से या अर्थ से कोई भी डिसीज इरेडिकेट होता है. याद रखना, स्मॉल पॉक्स हैज बीन इरेडिकेटेड फ्रॉम द वर्ल्ड, वेयर एज पोलियो हैज बीन एलिमिनेटेड फ्रॉम इंडिया, बिकॉज पोलियो इज स्टिल प्रेजेंट इन 3 countries, दैट इज पाकिस्तान, अफगानिस्तान एंड नाइजीरिया. याद रख लेना ये. ओके, मूविंग फर्दर टू द नेक्स्ट वन. ये लोगो क्या है? सो दिस लोगो इज फॉर अ इम्पॉर्टेंट नेशनल प्रोग्राम ऑफ इंडिया, एंड दैट इज नेशनल प्रोग्राम फॉर control of blindness and visual impairment. National program for control of blindness and visual impairment. आग बनी हुई है, easy है, right? So according to this program, blindness की definition क्या दी है? So please remember, blindness is defined as a vision of less than 3/60 in the best eye with best possible correction. So इस definition का मतलब क्या है? So please remember, vision should be less than 3/60. ये clear है? Okay. Okay. So in best eye with best possible correction मतलब क्या? So for example, तुम्हारी एक आई की विजन कितनी है? एक आई की विजन है तुम्हारी 1/60 राइट आई की. ओके, एंड लेफ्ट आई की विजन है तुम्हारी 2/60 फॉर एग्जाम्पल, राइट? सो इसमें से बेटर आई कौन सी है? लेफ्ट आई. लेफ्ट आई की भी विजन इज लेस देन 3/60, एंड इफ यू use best possible correction also, like spectacles or contact lenses, anything, then also the vision is not improving properly, therefore then it can be termed as blindness. याद रख लेना, vision less than 3/60 in best eye with best possible correction is defined as blindness according to this program. What is the most common cause of blindness? Important question, optha से भी question आ सकता है. The most common cause of blindness is cataract. Please remember, most common cause of blindness is cataract. Anybody can tell me what is the most common cause of cataract? कैटरैक्ट की सबसे कॉमन वजह क्या है? What is the most common cause of cataract? Just tell me in the chat box. So please remember, most common cause of blindness is cataract, followed by refractive errors. Second most cause of blindness is your refractive errors. Okay, please remember this. So most common cause cataract, followed by refractive errors. Okay, the prevalence of blindness. Okay, the prevalence is what? Please remember, prevalence is total number of cases. New as well as old cases are considered as prevalence. Okay, so the prevalence of blindness is 0.36%. Prevalence of blindness कितना है? 0.36%, and the goal under this program is to reduce this prevalence to less than 0.3%. अभी कितना है currently prevalence? 0.36%, and the goal is to reduce this prevalence to less than 0.3%. Right? Important one. Moving further to the next one, to the Vision 2020 program. Okay, so under this program only we have launched a program known as Vision 2020 India. So there is a Vision 2020 global program also, right? So all of us would be quite aware of this. So there is a global Vision 2020 program. Okay, so WHO ने एक global Vision 2020 program launch किया था, in which what was the main aim? So please remember, दोनों programs का main aim है to eliminate all the causes of avoidable blindness. So please remember, to eliminate all the causes of avoidable blindness, either which can be prevented or which can be treated adequately. All of these causes of blindness should be eliminated, right? So according to Global Vision 2020, there were 5 causes of these avoidable blindness which were taken into consideration, that can be remembered by the mnemonic TORCH. Okay, so T से क्या आएगा तुम्हारा? Infectious cause, that is trachoma. O से क्या आएगा? Onchocerciasis. Okay, onchocerciasis also known as river blindness. Then R से आएगा तुम्हारे refractive errors और low vision. C से आएगा तुम्हारा cataract. Okay, and H से आएगा hood. That is, याद रख लेना. So this is the mnemonic. Okay, ठीक है, याद रख लेना. So H से आएगा childhood blindness. याद रख लेना, childhood blindness. So these were the 5 diseases or the 5 preventable causes of blindness which were included in the Global Vision 2020 program. बट इंडिया में कौन सा एक डिसीज है जो नहीं प्रेजेंट इनमें से? इन ऑल दीज 5, विच इज द डिसीज और द कॉज ऑफ ब्लाइंडनेस विच इज नॉट प्रेजेंट इन इंडिया? सो देयरफॉर व्हाट इंडियंस थॉट इज to skip that disease, and rather we added 3 more important diseases which were common from the perspective of India, right? So हमने क्या include करा? C, we included cataract, we included refractive errors, most common causes है वो, then we included childhood blindness, and we also kept trachoma. But we skipped which one? So we removed onchocerciasis. So हमने क्या निकाल दिया? Onchocerciasis और river blindness. Why? Because the vector, yes, very good, it is onchocerciasis or river blindness. Because the vector for onchocerciasis या river blindness known as black simulum fly. क्या है वेक्टर उसका? ब्लैक सिमुलम फ्लाई. दैट इज नॉट प्रेजेंट इन इंडिया. अगर वेक्टर ही नहीं है तो डिसीज होगा ही नहीं, राइट? सो प्लीज रिमेंबर दैट इज द रीजन व्हाई वी स्किप्ड onchocerciasis. रादर वी एडेड 3 more other causes, that is diabetic retinopathy. ये याद रख लेना. They can ask you which of these is included in Vision 2020 India. So याद रखना है तुम्हें इंडिया वाले, that is diabetic retinopathy, glaucoma and corneal blindness. Usually they ask glaucoma in the exceptions all the time. Okay, कौन सा नया include हुआ है? तो that is your glaucoma. Okay, most of the times it is the one, but बाकी के भी याद रख लेना. Diabetic retinopathy, glaucoma and corneal blindness. Okay, then according to this program only, vision centers were established. 20,000 vision centers were established at the level of PHC. और इन विजन सेंटर्स पे क्या होता है? यूजुअली स्क्रीनिंग होती है विजन की, राइट, विद द हेल्प ऑफ स्नेलन्स चार्ट वगैरह. So this screening of vision usually takes place at this vision centers at PHC. 20,000 है. Then there are 2,000 service center located at the level of CHCs. Then there are 2,000 training centers located at the level of district hospitals and medical colleges. And lastly, there are 20 centers of excellence. Okay, and lastly there are 2 apex centers. So 2 के multipliers में है सब. Okay, 2 apex center. And the apex most institute for this program is your Dr. Rajendra Prasad Institute of Ophthalmic Sciences. Okay, Dr. Rajendra Prasad Institute of Ophthalmic Sciences, AIIMS, New Delhi. That is the apex institute for this program, Vision 2020 India, or for this national program for control of blindness and visual impairment. Now, the visual screening, vision screening usually it starts in the school itself. Okay, government schools में usually vision screening होती है. Okay, and that is the responsibility of the class teacher. Okay, vision screening in school is the responsibility of a class teacher, and one teacher screens 150 students. एक teacher कितने students को screen करती है? 150 students को. And if she finds that the vision is less than 6/9, if she finds that in any child if the vision is less than 6/9, then she will refer the child to PHC. मतलब PHC पे कौन सा सेंटर था? विजन सेंटर. ओके, सो शी विल रेफर द चाइल्ड टू विजन सेंटर टू द पैरामेडिकल ऑप्थेल्मिक असिस्टेंट. कौन होता है वहाँ पे? पैरामेडिकल ऑप्थेल्मिक असिस्टेंट. ही विल गिव द अप्रोप्रिएट नंबर ऑफ ग्लासेस और स्पेक्टेकल्स विच इज रिक्वायर्ड, राइट? इंपॉर्टेंट वन. So this is about your national program for control of blindness and visual impairment. Can anybody tell me, ये खत्म होने से पहले, which is the most common cause of preventable blindness? Which is the most common cause of preventable blindness? जो prevent किया जा सकता है. Which is the most common cause of preventable blindness? Because I have 1 or 2 more things to tell you regarding that only from the immunization schedule. So now you get a hint. So which is the most common cause of preventable blindness worldwide? Please tell, which is the most common cause of preventable blindness? So please remember it is your, I'll wait for a while because I feel there's like, yes, very good Diamond, it is your vitamin A deficiency. Please remember it is your vitamin A deficiency, also known as xerophthalmia. क्या बोला जाता है इसको? Xerophthalmia, right? So please remember, xerophthalmia or vitamin A deficiency is the most common cause of preventable blindness. Okay, याद रख लेना ये. Very good guys. Now moving further. और हाँ, मैंने विटामिन ए के लिए बोला था. सो इम्यूनाइजेशन से क्या याद रखना है? सो प्लीज रिमेंबर विटामिन ए इज गिवन इन द इम्यूनाइजेशन शेड्यूल. ठीक है, जो फर्स्ट डोज होता है विच इज गिवन एट 9 months ऑफ एज. फर्स्ट डोज ऑफ विटामिन ए इज गिवन एट 9 months ऑफ एज. विटामिन ए सोल्यूशन होता है, ओरल सोल्यूशन. ठीक है, दैट इज गिवन 1 ml विच कंटेन्स 1 lakh units. Okay, which contains 1 lakh units. Then from 1 year itself till 5 years, 1 से 5 साल के बच्चे तक every 6 months में it is given. So that becomes total of 8 doses and they are given 2 ml or 2 lakh international units. Total making it a 17 lakh international unit. So total dose कितना जाता है 5 years तक बच्चे में विटामिन ए का? 17 lakh international units. And how many doses? This is the first dose and next 8 doses. So 9 doses are given. कितने डोज? 9 doses. कितने यूनिट? 17 lakh international unit of vitamin A. Right? Please remember this. Now moving further guys, next image. Okay, so this is the logo for which program? So please remember, खून की बूंद दिख रही है, right? You can see a drop of blood. So please remember it is your Anemia Mukt Bharat. So this is the program known as Anemia Mukt Bharat, that is Anemia Free India, right? So this Anemia Mukt Bharat program was launched in the year 2018, okay? And iska main aim kya hai? So the main aim of this Anemia Mukt Bharat program is to reduce the prevalence of anemia by 3% every year by the year 2022. To reduce 3% prevalence of anemia every year. मतलब 2019 में 3%, 2020 में और 3%, 2021 में और 3%. So likewise, 3% prevalence to be decreased every year till the year 2022. Okay. उसके लिए strategy क्या है? What is the strategy behind it? So please remember the strategy in it. It is 6 by 6 by 6. Okay, strategy का नाम है 6 by 6 by 6. So according to that, there are 6 beneficiary groups. Okay, there are total 6 beneficiary groups of this program. Okay, 6 beneficiary groups में कौन आता है? Who are more susceptible to anemia, right? First of all, there would be 5 years तक के जो children होते हैं. Okay, children till 5 years of age group, 6 months to 5 years of age group children. Second are your school going age group children. Third are your adolescent females, 11 to 18 years of females, याद रख लेना, only girls. Next is your pregnant and lactating females. Next is your non-pregnant and non-lactating females in the reproductive age group. Non-pregnant and non-lactating females in the reproductive age group. Reproductive age group means 15 to 49 years of age group. ये याद रख लेना, many of you are confused. Please remember, reproductive age group is 15 to 49 years of age group. That is used in many of the definitions. Okay, याद रखना. So please remember this, okay? So there are total 6 beneficiary groups. Then there are 6 interventions which are to be undertaken, and there are 6 institutional mechanisms which are deployed for it. Okay, please remember. So this is your Anemia Mukt Bharat 2018, right? Now, please remember guys, according to this, can anybody tell me, according to this program only, we give iron and folic acid tablets, okay? So उस पे question आया है बार बार. So can anybody tell me, in pregnant and lactating females, what is the dose of iron and what is the dose of folic acid in the tablet? Red color की tablet होती है, okay? There are red color tablets for pregnant and lactating females, right? Pink color tablets for less than 5-year-old children, and blue color tablets for your school going children. याद रख लेना, because they contain different amounts, okay? They contain different amounts of iron and folic acid. So how much elemental iron is there and how much folic acid is there? Can anybody tell me that? So please remember, it contains 100 milligram of elemental iron. कितना elemental iron होता है? 100 milligram of elemental iron, whereas 500 micrograms of folic acid. 500 micrograms of folic acid, okay? 100 milligrams of elemental iron, whereas 500 micrograms of folic acid is given in the tablets, okay? 60 milligram is usually given for adolescents, okay? So please remember, 60 milligram जो होता है, it is given till adolescents, याद रख लेना, okay? Then moving further guys to our next one, and this is the logo for your national program for prevention and control of diabetes, cardiovascular diseases and stroke. So this program is known as NPCDCS in short, okay? So this is the logo which says health in your hands, आपकी सेहत आपके हाथ. So please remember, this national program for prevention and control of diabetes, cardiovascular diseases and stroke, this program was launched for all the diseases which are non-communicable, okay? For all the non-communicable diseases whose prevalence can be reduced just with lifestyle modification. जिनका prevalence कैसे कम किया जा सकता है? With lifestyle modifications. So for that purpose, what was included in this program? In this program, there was health promotion included. Okay, health awareness, health promotion, health education, all of these things were included. Then opportunistic screening was done for blood pressure, sugar. Okay. Then referral was done. If any abnormalities were seen, referral to a higher unit was done. Then diagnosis and management of all the non-communicable diseases was done under this program. Can anybody just tell me which is the first referral unit? This is a very common question. So healthcare system of India we have discussed already. ठीक है, बहुत चीजें हम discuss कर चुके हैं. Can anybody tell me, this was a question asked earlier, which is the first referral unit in the healthcare system of India? Which level? Which is the first referral unit? Can anybody tell me this? Which is the first referral unit? Which is the first referral unit, guys? Sub-center, PHC, CHC, district hospital. Can anybody tell? First referral unit. So please remember guys, the first referral unit would be CSC. Very good Sandeep, because people get confused over here. The first referral unit is your community health center or CHC. याद रख लेना, which is located mostly at the district level. Yes, please remember bright, it is not PHC. PHC से patient refer होता है. कहाँ refer होता है? CHC में. So please remember CHC would be considered as the first referral unit, and the second referral unit would be your tertiary health centers. Okay, tertiary health centers would be your secondary referral unit. That is your district hospitals or medical colleges. Okay, please remember this. Then moving further to the next one. This image, ये जो दिख रहा है picture में, where you have all these concentric circles. These concentric circles show you a phenomena. And what is this phenomena known as? This phenomena is known as rule of halves. इस phenomena को क्या बोला जाता है? This phenomena is known as rule of halves. Okay, and this they can ask you, either they can give you this picture or they can ask you that rule of halves phenomena is shown by which disease. So please remember, rule of halves phenomena is shown by hypertension. Rule of halves phenomena is shown by hypertension. So what does it signify? Please remember, the outermost circle is your whole community. Then the circle inside it, it is like the half of it would be your hypertensive subjects. Then the other half of these hypertensive subjects would be diagnosed cases of hypertension. The other half of these diagnosed cases would be treated also, and the other half of these treated cases would be adequately treated. Right? So this is the meaning of your rule of halves, which is shown by the hypertension in the community. याद रख लेना. Then moving further, this blue ring, okay, इसका एक बार question आया था NEET PG और AIIMS में. So please remember, this blue ring is for which disease? This blue ring is for your diabetes. Okay, diabetes के लिए है तुम्हारी blue ring, diabetes mellitus के लिए. Please remember. Yesterday we discussed a red ribbon. Red ribbon was for HIV/AIDS awareness. Red ribbon was for your HIV/AIDS awareness, right? Just a minute. So this pink ribbon today, it is, please remember, it is for your breast cancer awareness. Okay, pink ribbon is for your breast cancer awareness. Just a question from OBG and PSM again. Which is the best screening test available for breast cancer screening? Which is the best screening test available? Preliminary screening test अगर पूछा जाए, definitely the answer would be what? Breast self-examination. The girl can just examine the breast by herself, right? Please remember, in the upper outer quadrant, right? It is the most common site for your breast cancer. So that is a preliminary breast examination. Then, but what is the best screening test? We have usually investigation, because this method of breast self-examination is not that much reliable, right? Therefore, we have investigations. Which is the best screening test? Anybody? A question which have been asked earlier also from radio, from OBG, from PSM. Important question. Can anybody tell me? Age group भी matter करता है यहाँ पे. अब याद आए तुम्हें, maybe more than 35 years of age group we prefer this investigation. Yes, very good. It is your mammography. Please remember, it is your mammography. Please remember this. Okay, so mammography is the best screening test for best breast cancer screening. Okay, and usually for less than 35-year age group females, okay, who are in the reproductive age group, okay, or in the childbearing age group, we can say, in this usually we prefer ultrasound. Okay, in this we usually prefer ultrasound. Okay, and in high risk females we usually prefer MRI. ये तुम रेडियो में पढ़ ही लोगे. Moving further now to our next one. This logo is suggestive of which program? So please remember, ये जो दिख रहा है, it has a tagline, शक्ति और बुद्धि का रक्षक आयोडीन नमक. So this we all belong to 90s mostly. So सबने यहाँ ad देखा ही होगा, right? So this is the logo for your National Iodine Deficiency Disorder Control Program. Okay, बहुत बड़ा नाम है, National Iodine Deficiency Disorder Control Program. इसी का पहला नाम था National Goiter Control Program, but which was replaced by this new name, National Iodine Deficiency Disorder Control Program, NIDDCP, in the year 1992. Okay, please remember. And according to this program, every individual should consume iodized salt in the country, right, to reduce the prevalence of goiter. एंड जैसे ही हमें पता है टाटा नमक खाते हैं हम या आयोडाइज नमक खाते हैं, उससे गॉइटर का प्रेवलेंस कम हो गया इंडिया में. सो द सॉल्ट आयोडिनाइजेशन इज द मेन पर्पज ऑफ दिस प्रोग्राम. सो सॉल्ट आयोडिनाइजेशन की लेवल कितनी होनी चाहिए? एट प्रोडक्शन लेवल इट शुड बी 30 पार्ट्स पर मोल. ओके, 30 ppm और 30 पार्ट्स पर मोल एट प्रोडक्शन लेवल एंड 15 पार्ट्स पर मोल एट कंज्यूमर लेवल. ओके, सो प्लीज रिमेंबर, प्रोडक्शन लेवल पे 30 ppm, कंज्यूमर लेवल पे 15 ppm, प्रोडक्शन लेवल पे 30 ppm, कंज्यूमर लेवल पे 15 ppm. इट इज द लेवल ऑफ सॉल्ट आयोडिनाइजेशन. ओके, ये चीज़ें ऐसी है ना जो रटने वाली यही के यही रट लो. ओके, प्लीज रिमेंबर दिस. मूविंग फर्दर टू आवर नेक्स्ट वन. सबसे पहले तो मैं ये कट कर लूँ. या नाउ इन दिस क्या दिख रहा है ये लोगो? सो दिस लोगो इज फॉर प्रधानमंत्री सुरक्षित मातृत्व अभियान. ओके, सो दिस इज फॉर योर प्रधानमंत्री सुरक्षित मातृत्व अभियान. ओके, विच इज कंडक्टेड ऑन द 9th of every month. एंड क्या होता है इसमें? सो प्लीज रिमेंबर, इन दिस प्रोग्राम यूजुअली फ्री एंटीनेटल केयर चेकअप्स आर गिवन on the 9th of every month. Okay, 9 Jan, 9th Feb, 9th March. So accordingly 9th of every month there would be free antenatal care checkups for all your pregnant females. सभी pregnant females के लिए there would be free antenatal care checkups at all the government facilities. And in this program, as we all know, in the government facilities it would be conducted, but private doctors are also included in this. Okay, voluntary है ये. Private doctors are also asked to be the part of this program. Okay, so please remember this. So प्रधानमंत्री सुरक्षित मातृत्व अभियान, free antenatal care checkups on the 9th of every month at all the government healthcare facilities. It is given by the Ministry of Health and Family Welfare, Government of India. Right, याद रख लेना ये. So वो सुमन क्यों काटा मैंने? Because सुमन is a different program, guys. Please remember. So सुमन is what? सुमन is सुरक्षित मातृत्व आश्वासन स्कीम. Okay, so please remember it is your सुरक्षित मातृत्व आश्वासन. Just a minute. Okay, this is your सुरक्षित मातृत्व आश्वासन स्कीम, according to which इसका मेन गोल क्या है सुमन का? It is to bring down the maternal and neonatal deaths. Okay, maternal and neonatal deaths to zero. Okay, इसका एम क्या है? To bring down the maternal and neonatal deaths due to preventable causes to zero. अगर हम उस बच्चे को या माँ को बचा सकते हैं, then these उनकी डेथ वो प्रिवेंटेबल कॉजेज की वजह से नहीं होनी चाहिए. ओके, दैट इज द मेन एम ऑफ दिस सुमन, सुरक्षित मातृत्व आश्वासन, टू ब्रिंग डाउन द मैटरनल एंड न्यूनेटल डेथ्स ड्यू टू प्रिवेंटेबल कॉज टू जीरो. Please remember this. This is your Surakshit Matritva Ashwasan. Okay, both of them have their websites. Okay, on the digital portal of India. Okay, so moving further to the next one. Mostly तुम logos याद रख लेना, या एक दो जो points important वाले बता रहा हूँ, that those are important. Next one. This is the logo which has been used for your baby friendly hospitals. Okay, this is the logo used for your baby friendly hospitals. Then just a similar one. But जहाँ से a child is put close to a mother's skin or a father's skin, that is known as which care? Can anybody tell me? That is a very important question. When a child or a newborn is put close to the mother's skin or the mother's body or to a father's body, that is known as which care? Can anybody tell me? Okay, the first image is for the baby friendly hospitals which have the neonatal specialized care units, right, that we have discussed yesterday. So those are for these baby friendly hospitals. And next one, this is for your India Newborn Action Plan. Okay, this is very clear. This is for your India Newborn Action Plan, INAP, India Newborn Action Plan. Okay, याद रख लेना. Yes, very good, Bright. It is for your kangaroo mother care. Okay, it is for your kangaroo mother care. So whenever child is put in close association to a mother's body or a father's body, that is your kangaroo mother care. Okay, KMC. Yes, very important one. It is to prevent hypothermia in neonates. It is to prevent hypothermia in neonates. Okay, please remember this. Next one. Yes, very good. Next one is your National Health Insurance Scheme. Okay, this is your National Health Insurance Scheme. इसको और क्या बोला जाता है? राष्ट्रीय स्वास्थ्य बीमा योजना. Okay, this is also known as a National Health Insurance Scheme or राष्ट्रीय स्वास्थ्य बीमा योजना, which is a National Health Protection Scheme. Right. So this was launched by the Ministry of Labour. This was launched by the Ministry of Labour, Government of India. Okay, for all the laborers, जितने भी laborers है ना below poverty line, उनके लिए स्कीम लॉन्च करी गई थी, in which 30,000 तक का medical care, medical care was given. Okay, up to 30,000 of medical aid can be taken under this National Health Insurance Scheme. Can anybody tell me this National Health Insurance Scheme is now a component of one of the umbrella program of India for national health protection? वो बड़ा सा प्रोग्राम मोदी जी ने लॉन्च किया है, क्या नाम है उसका? 5 लाख पर एनम पर फैमिली, ये जो बात हुई थी, आई टोल्ड यू ऑलरेडी राइट yesterday that it is the umbrella program which involves all the other national health protection or insurance schemes, right? So tell me that. In the meanwhile, we'll come to the next image, the last image on this slide. So that is your National Tobacco Control Program. ये लोगों किसका है? It is for your National Tobacco Control Program. This signifies victory over the tobacco addiction. Okay, so please remember, इसमें क्या है टैगलाइन इनकी? जिंदगी चुनो तंबाकू नहीं, right? National Tobacco Control Program. This is the logo used for it. Now यहाँ पे एक दो days important है, वो याद कर लेना. Can anybody tell me which is, when do we observe no tobacco day? When do we observe no tobacco day? Important है, याद रख लेना. When do we observe no tobacco day? Yes, it is your प्रधानमंत्री जन आरोग्य योजना, that is your आयुष्मान भारत स्कीम. आयुष्मान भारत स्कीम उसी के अंडर आता है ये तुम्हारा नेशनल हेल्थ इंश्योरेंस स्कीम और राष्ट्रीय बीमा स्वास्थ्य बीमा योजना, राइट? एनीबडी कैन टेल मी नो टोबैको डे इज ऑब्जर्व्ड ऑन विच डे? इट इज ऑब्जर्व्ड ऑन विच डेट? नो टोबैको डे इज ऑब्जर्व्ड ऑन विच डेट? और एक बता दो चलो, इंपॉर्टेंट वन, वर्ल्ड टीबी अवेयरनेस डे कब मनाया जाता है? When do we observe World TB Awareness Day? दोनों के आंसर्स बता देना, इंपॉर्टेंट है. बाकी के डेज हम अकॉर्डिंगली डिस्कस करते जाएंगे, अभी तो ये दो बता दो. नो टोबैको डे इज ऑब्जर्व्ड एंड वर्ल्ड ट्यूबरकुलोसिस अवेयरनेस डे इज ऑब्जर्व्ड ऑन. So please remember guys, no tobacco day is usually observed on 31st of May. No tobacco day is usually observed on 31st of May, whereas World Tuberculosis Awareness Program, World Tuberculosis Awareness Day is observed on 24th of March. Okay, World TB Awareness Day is observed on 24th of March. दो important dates से याद रख लेना. No Tobacco Day 31st May, World TB Awareness Day 24th of March. Moving further to our next logo in the line, that is your आरोग्य सेतु ऐप. क्या है ये? This is your आरोग्य सेतु ऐप, right? मैं सुरक्षित, हम सुरक्षित, भारत सुरक्षित is the tagline. What is आरोग्य सेतु? Everybody of us has it on our mobile. Okay, भले ही मजबूरी से क्यों ना हो, but everybody of us has it. So please remember, आरोग्य सेतु app, it is a mobile application developed by the government of India to connect the essential health services with the people of India in our combined fight against COVID-19. So इसमें क्या होता है? You can see that how many active cases are there in your surroundings, right? Along with that, you can also undertake a self-assessment test in this. Okay, self-assessment कर सकते हो तुम अपनी, right? Along with that, there are some information about vaccination centers also available in this app, right? And this app replaced the previous app known as Corona Kavach. इसके पहले एक app आई थी known as Corona Kavach, but then a universal app was launched for all COVID-19 services. That was the Arogya Setu app. Arogya means health, Setu means bridge. Okay, bridge towards health. ये इसका मतलब था, right? Important one. Moving further to our next one, an important logo that we have, and this logo, it is what? ESIC, that is Employee State Insurance Corporation, right? So this Employee State Insurance Corporation is a subunit of the Ministry of Labour, Government of India. Okay, so जो Ministry of Labour है, Government of India, उसका एक subunit है this Employee State Insurance Corporation, ESIC, and this ESIC have a lot of hospitals, all the ESI hospitals across India. The Apex Center is located in Basidarapur, New Delhi. Okay, so please remember, all these hospitals are meant to provide free healthcare services for all those who are covered under this Employee State Insurance Act. And कौन लोग होते हैं who are covered under this Employee State Insurance Act? So please remember, first of all, this Employee State Insurance Act was launched in the year 1940. Okay, it was launched in the year 1940. एक important बात, right? It was launched by the Ministry of Labour, Government of India. Important one, right? So according to this, क्या था कि all the employees or laborers who have a salary or wages less than 21,000 per month, who have salary or wages less than 21,000 per month, are included in this Employee State Insurance Act. Okay, इनका क्या होता है? There is a fund which is collected, okay, the ESIC, Employee State Insurance Corporation collects fund from the employer as well as employee, मालिक से और नौकर से, दोनों से fund collect करते हैं, and then the employee gets the benefit for himself as well as for his family of free health services. ठीक है, याद रखना. So employer pays 3.25% of the wages, whereas employee pays 0.75% of the wages. Employer means मालिक, याद रख लो, employer means मालिक and employee means नौकर. Okay, if anybody has any issues with this, employer, that is Malik, pays 3.25% of the wages, whereas employee pays 0.75% of the wages, making it a total of 4% of the wages. Making it a total of 4% of the salary is paid to this Employee State Insurance Corporation, okay, which collects all these funds and then provides free healthcare services in the ESI hospitals. Okay, then according to this ESI Act, guys, these laborers usually can take holidays for the sickness, and this is known as the sickness benefit. The sickness benefit which is provided under ESIC Act, it is for 91 days. Sickness benefit under ESI Act is for 91 days on 70% wages. Full wages तो नहीं मिलेंगे, but 70% wages are given. Okay, so sickness benefit कितने दिन का है? 91 days का on 70% of wages, याद रख लेना. Next is your extended sickness benefit. Extended sickness benefit would be taken for chronic diseases like tuberculosis, right? And this extended sickness benefit is for 2 years. Extended sickness benefit is for 2 years on 80% wages, on 80% of wages. Please remember this. Whereas there is maternity benefit, and maternity benefit, ये जो है, this is applicable for all the companies or all the corporations, okay, irrespective of they are coming under ESI or not. Okay, ये तो गवर्नमेंट ऑफ इंडिया का फुल फ्लेज प्रोग्राम है जो सबके लिए लागू होता है. ओके, it is applicable for every company. So maternity benefit is of 26 weeks. It was increased to how many weeks? 26 weeks or 6 months. The maternity benefit was increased to 26 weeks, okay, on 100% wages, on 100% of wages. Please remember this. This is the logo which has a tagline सामाजिक सुरक्षा और social security. Right, please remember this. Important है ये contribution. Employer 3.25%, employee 0.75%. Right. Then moving further, guys, to the next one. This is the next logo that we have, and it is for your National Rural Employment Guarantee Act, also shortly known as NREGA. Some people call it as MNREGA, Mahatma Gandhi National Rural Employment Guarantee Act. Right. So it is also known as Rashtriya Gramin Rozgar Guarantee Adhiniyam. Okay. So please remember, it is the National Rural Employment Guarantee Act, launched in the year 2005, known as NREGA popularly. So in this, what are the benefits that are seen? So please remember, more than 100 days of employment per year is provided. कितने दिन की? Minimum 100 days की. Okay, so therefore this 100 signifies minimum 100 days of employment. Okay, so minimum 100 days of employment per year is given to how many people in the family? Maximum 1 member. बस एक member को मिल सकती है वो. Maximum 1 member per below poverty line, BPL family. And कौन से काम होते हैं usually? These unskilled manual labor. क्या होता है इसमें usually? Unskilled manual labor. Okay, minimum 100 days of employment is guaranteed. Maximum 1 member of BPL family can take the benefit, and usually the work is unskilled manual labor. Right, this is known as NREGA. I hope this is clear. Moving further to our next one, and this is your IDSP, that is Integrated Disease Surveillance Project. क्या है ये लोगो किसका है? Integrated Disease Surveillance Project. मैंने बोला था सर्विलेंस का क्या मतलब है? मॉनिटरिंग करना और एनालिसिस करना उसका, राइट? दैट इज योर सर्विलेंस, राइट? सो प्लीज रिमेंबर, कीपिंग एन आई ऑन समथिंग, दैट इज सर्विलेंस, राइट? सो CCTV सर्विलेंस होता है ना, उसी तरह से. सो इंटीग्रेटेड डिसीज सर्विलेंस प्रोजेक्ट, IDSP, दिस इज द लोगो, प्लीज रिमेंबर. देन इट एनकम्पासेस 3 टाइप के सर्विलेंस होते हैं हमारे पास, दैट इज रेगुलर सर्विलेंस, सेंटिनल सर्विलेंस एंड पीरियोडिक सर्विलेंस, राइट? So regular surveillance would be carried out for seasonal diseases like measles या फिर dengue or या malaria. For all these diseases there would be regular surveillance. Along with that, important disease like tuberculosis, इसके लिए भी we need to carry out regular surveillance, right? Next is your sentinel surveillance. Sentinel surveillance पे question बार बार पूछा जाता है, please remember. Sentinel surveillance is usually performed for the diseases which have hidden cases या undiagnosed cases. Okay, people don't usually come out with it. Okay, the diseases like HIV, Okay, so please remember HIV would have which type of surveillance? For HIV we will carry out sentinel surveillance. And last is your periodic surveillance. In periodic surveillance it is carried out for your all non-communicable diseases like diabetes mellitus, hypertension, right? It is taken from period to period, okay, over a period of time. Okay, so these are the three types of surveillance scene. Next, there are three forms to be filled. Okay, there is the S form in which you need to fill up the syndromic diagnosis, which is filled up by the healthcare worker. क्या दिख रहा है? Flu दिख रहा है. So that is a syndromic diagnosis. Next is your presumptive diagnosis, that what you suspect. Okay, it is filled in the P form and it is to be filled by the doctor or the medical officer. And last is your lab confirmed diagnosis to be filled in the L form, which is filled by the lab technicians or the lab workers, right? So I hope this is clear to you. It is your integrated disease surveillance project, IDSP. Moving further to our next lab, and that is National Disaster Response Force, NDRF बोला जाता है. क्या बोलते हैं हम इसको? NDRF. यहाँ पे सब जवान दिख रहे हैं ना, so they make a chain. Okay, so please remember. This is for example, this is your India, and protecting India, it is your National Disaster Response Force. ऐसे याद रख लो. Okay, so National Disaster Response Force या NDRF के जवान, कहीं भी कोई भी natural calamity आती है, we hear on news channels, right, कि NDRF के जवान पहुंच गए. So those are these NDRF personals, which includes all your ITBP or CISF, okay, or some of the border security forces are also included in this at times. Okay, so this National Disaster Response Force comes under the National Disaster Management Authority. ये किसके अंडर होता है? National Disaster Management Authority और NDMA. Okay, so NDRF comes under National Disaster Management Authority, and this National Disaster Management Authority, उसका chairperson कौन होता है? So please remember, the chairperson of NDMA is the Prime Minister himself. The chairperson of NDMA is the Prime Minister himself. And here we get confused कि और एक question पूछा जाता है, which is the nodal ministry for NDMA. Okay, for national disaster, which is the nodal ministry. So please remember that nodal ministry is Home Affairs Ministry. Okay, nodal ministry is Home Affairs Ministry. This comes under Home Affairs Ministry. Okay, याद रखना. But the chairperson would be Prime Minister, not Home Minister. याद रख लेना, chairperson is Prime Minister only. He'll keep an eye on all the things. But it comes, the nodal ministry would be Home Affairs Ministry, and the nodal center जहाँ से सब चीज़ें करेंगे, like all the rehabilitation work, all the medical care would be provided from which center? It would be provided from a district with the help of the district magistrate or your collector. Right, so he will be the in charge medical officer. He would be the in charge officer for all the disasters. Right, so the nodal center would be district. Nodal center is district. Nodal ministry would be Home Affairs Ministry, and the chairperson of NDMA would be Prime Minister. याद रखना. Next one, just a minute, guys. The World Disaster Reduction Day. World Disaster Reduction Day is observed on 13th of October. World Disaster Reduction Day is observed on 13th of October. और इसी से मिलता जुलता एक 16th of October याद रख लेना. 16th of October is observed or celebrated as World Anesthesia Day. It is celebrated as World Anesthesia Day. Why? Because ether was used as an anesthetic agent first on 16th of October. Therefore, 16th of October is observed as World Anesthesia Day, and 13th of October is observed as World Disaster Reduction Day. I hope this is clear. Okay, and this is the logo for NDRF. They say Aapda Seva Sadaiva. Okay, that is the logo. That is the tagline. Sometimes taglines are also helpful. Okay. Next one, this image shows you a disaster management cycle. ये image क्या दिखा रही है तुम्हें? Disaster management cycle. इस image में क्या दिख रहा है हमें? There are 4 phases of a disaster management cycle. There are how many phases? Mainly 4 phases of a disaster management cycle. So after a disaster impact, first phase would be response. सबसे पहले क्या होगा? Response, which will include search and rescue services, right? And also with that, there would be emergency relief provided. Next phase would be your recovery phase, in which there would be rehabilitation of the individuals and reconstruction. Next, third phase would be your mitigation. Mitigation is prevention of the upcoming disaster. And last, fourth phase is your preparedness before a disaster. That is, early warning should be given for a disaster, or the authority should be prepared for facing this natural calamities or disasters, right? So these are the 4 important phases of disaster. Please remember: response, recovery, mitigation and preparedness. Please remember this. And in this response phase, the first phase, usually we have the health and medical relief which comes under this. हमारा मतलब किससे है? Health and medical relief से है. Okay, important one. So health and medical relief के according, so please remember, it is divided into, the response phase is divided into 3 phases: primary phase, secondary follow-up and tertiary cleanup. So primary phase lasts for 0 to 6 hours, which includes your first aid and medical care. Okay. Secondary follow-up from 6 to 24 hours, which includes transportation, sanitation and immunization. Whereas tertiary cleanup includes providing all the food, clothing, shelter, all the social services or rehabilitation. Right? Please important. Then disaster के बारे में एक question पूछना चाहूँगा. Just answer in the chat box, guys. What is the like? I'll ask you a definition. Tell me that what it is. Okay. Segregation of injured patients at the disaster site is known as. Segregation of disaster patients at the disaster site is known as. Segregation of patients at the disaster sites is known as. उसका एक नाम है specific. Segregation or separation of patients according to the help they need, emergency help they need. इसको क्या बोला जाता है? It is known as triage. याद रख लेना, that is known as triage, right? So please remember, triage is nothing but segregation of separation of patients depending on the help or the medical help they need, right? So according to that, we have 4 color coded categories, right? The highest category is your red color code, second is your yellow or blue color code, third is your green color code, and fourth is your black color code. Okay, fourth is your black color code. Yes, very good. Now, so red color code would be those individuals who require limb or life-saving surgeries within 6 hours, or they require immediate resuscitation, or otherwise they will die. Those are red category patients. Yellow or blue category patients would be those who require limb or life-saving surgeries within 6 to 24 hours. Next are your green category patients who are ambulatory patient. इधर उधर घूम सकते. They have minor scratches here, then minor stitches they require. Okay. And last are your black category patients. Those are unsalvageable or moribund patients. Okay, who cannot be saved. Okay, almost dead patients, right? Or who are about to dead. Whatever you do, they will die. So those are on your least priority. याद रख लेना. These are on your least priority. This I'll repeat in surgery. Then moving further, guys, to the next one. This logo is for which program? So please remember, this logo is for your Pradhan Mantri Jan Dhan Yojana. So this logo is for your Pradhan Mantri Jan Dhan Yojana. Okay. The tagline says Mera Khata Bhagya Vidata. Okay, rupee symbol is given in the between. So please remember, this Pradhan Mantri Jan Dhan Yojana was launched by the Ministry of Finance, Government of India. Ministry of Finance, Government of India, right, in the year 2014. And according to this has aim or main aim or goal of financial inclusion. Okay, so all of the citizens of India should be financially connected to the banks, right? Therefore everybody should have their bank accounts, right? So that was the main aim of this Pradhan Mantri Jan Dhan Yojana or scheme, right? Please remember, under Ministry of Finance, Government of India. The next one, you have this logo which resembles a sun over here. This is for your Aadhaar. Okay, UIDAI, that is your unique identification number जो provide किया जाता है. This is the logo for your Aadhaar card. Sometimes they can ask you anything, they can ask, okay, in PSM. Next program that we have is, the logo is important, guys. So please remember, this logo which has a light bulb on it, a LED bulb rather, it is for this program known as Ujala. कौन सा program है ये? Ujala. So Ujala is Unnat Jyoti. Okay, Ujala is Unnat Jyoti by affordable LEDs for all. Okay, Ujala का full form क्या है? Unnat Jyoti by affordable LEDs for all. Okay, it was launched by the Ministry of Power, Government of India. It was launched by Ministry of Power, Government of India. In this program, there was distribution of LEDs to be done at affordable and subsidized prices. As we all know, electricity is less consumed in LED bulbs usually as compared to the traditional conventional bulbs that we have. Therefore, distribution of these LED bulbs at affordable and subsidized prices were to be done to mostly below poverty line families. Okay, under this program known as Ujala, Unnat Jyoti by affordable LEDs for all, launched by Ministry of Power, Government of India. Next one, similar sounding one is your Pradhanmantri Ujjwala Yojana. This is your Pradhanmantri Ujjwala Yojana. Please remember this. Pradhanmantri Ujjwala Yojana. That was Ujala means Roshni, okay, lightning, right? So that is easy to remember. This is your Ujjwala Yojana, launched by the Ministry of Petroleum and Natural Gas, Government of India. This Pradhan Mantri Ujjwala Yojana was launched by the Ministry of Petroleum and Natural Gas, Government of India. Easy, ये LPG cylinder दिख रहा है easily सामने, okay? So the tagline says स्वच्छ ईंधन बेहतर जीवन, okay? As we all know, a risk of respiratory diseases was increased due to the traditional methods of cooking which was practiced by the women in rural areas of India. Therefore, to overcome that challenge, because LPGs were very much costly, therefore free LPG connections were given, okay? Free LPG connections are given to the below poverty line families, and the gas cylinders are also given at subsidized rates. Okay, पहले तो free LPG connection दिया जाता है, and then the cylinders are given at subsidized rates to below poverty line families. This is known as Pradhan Mantri Ujjwala Yojana, right? Important one. Moving further to the next one, similar sounding again, that is Ujjwala Yojana, that we have already discussed yesterday, the first only. So this is your Ujjwala Yojana. Just a minute. Just revise it once again. Ujjwala Yojana, it is by the Ministry of Women and Child Development. They have launched it. So it is a comprehensive scheme for prevention of trafficking, okay? जो kidnap होते हैं उनके लिए, prevention of trafficking and rescue, rehabilitation, reintegration of all these victims of trafficking and commercial sexual exploitation. उनके लिए ये program launch किया गया है, उजावाला योजना, by the Ministry of Women and Child Development, Government of India. Moving further, these are the two logos that you need to remember. First logo says बेटी बचाओ बेटी पढ़ाओ. So this is the logo for Beti Bachao Beti Padhao Abhiyan, launched by the Ministry of Women and Child Development. Launched by the Ministry of Women and Child Development. You can see a notebook over here, right? A girl child. Please remember this. Next one is your Beti Bachao Save the Girl Child. Okay, so please remember this is for the Beti Bachao campaign. Okay, and this Beti Bachao campaign or program, it is again launched by the Ministry of Women and Child Development, and this is to prevent infanticides and feticide, female infanticides and female feticide को prevent करने के लिए है ये, okay? Female infanticide and female feticide को prevent करने के लिए, right? This Save the Girl Child campaign. Moving further, guys, to the next one, and this logo is for your Ayush, okay? Ayush department के लिए. So please remember, Ayush is the department under the Ministry of Health and Family Welfare, Government of India. Ayush is a subunit of the Ministry of Health and Family Welfare, Government of India, and this Ayush department looks after all the alternative forms of medicine which are practiced in India apart from allopathy, right? Apart from allopathy, we have which forms of alternative medicine? Please remember, A here stands for Ayush is an abbreviation. So A stands for Ayurveda, Y stands for Yoga and Naturopathy, U stands for Unani, S stands for Siddha, and H stands for Homeopathy. Okay, again, A for Ayurveda, Y for Yoga and Naturopathy, U for Unani, S for Siddha, and H for Homeopathy. It comes under Ministry of Health and Family Welfare, Government of India. The tagline is Sarve Santu Niramayaha, means let everyone be healthy. Okay, moving further to the next logo that we have in line, and this logo all of us are quite aware of this, that is for International Day of Yoga. This is for your International Day of Yoga, observed on 21st of June every year. 21st of June पे observe करते हैं every year. Okay, it is idea given by India itself, right? It is practiced by all countries worldwide now, so as it was accepted in the UN itself. So International Day of Yoga practiced on 21st of June. So yoga for harmony and peace, and this is the logo for it, right? Important. Moving further, now this is very much important, guys. These are the some important logos for different agencies which looks after the standardization of different products in India. Okay, इस पे questions आए हैं बार बार, so please remember these. So first logo, it is your ISI mark. First logo किसका है? That is for your ISI mark, right? First logo is for your ISI mark. ISI means Indian Standards Institution. ISI means Indian Standards Institution. So the ISI mark is the standards compliance mark for industrial products in India since 1955. So 1955 से आगे जितने भी इंडस्ट्रियल प्रोडक्ट्स आए हैं इंडिया में, उनका स्टैंडर्डाइजेशन की दे मीट द रिक्वायर्ड स्टैंडर्ड लेवल्स और नॉट. So that is actually looked after by this Indian Standards Institution, ISI. Okay, and they put a mark on it, ISI mark, right? So that is your ISI mark. Next one, just below the ISI mark we have this yellow colored mark which is known as AG mark. Okay, AG mark, easy to remember. AG mark is a certification mark employed on agricultural products. AG for agricultural products in India, assuring that they conform to a set of standards. So the set standards ko did these agricultural products meet or not, that is looked after by this AG mark. Okay, that is the agency of Government of India. So, and this is the mark which is there. Okay, so AG mark for agricultural products, ISI for industrial products. And food के लिए क्या होगा फिर? So please remember, for food the logo which is there. Okay, Food Safety and Standards Authority of India. So FSSAI is responsible for protecting and promoting public health through the regulation and supervision of food safety. Okay, so food safety के लिए ये देखती है and they promote public health via that. Okay, so Food Safety and Standards Authority of India. And now the last important one, this is the logo which appeared in the August 2020 session. Okay, and this was the tagline which was seen, Manakaha Patha Pradarshakaha. Okay, this is the logo for the Bureau of Indian Standards. Okay, this is again an agency of Government of India, Bureau of Indian Standards. BIS, it is the national standard body of India. So now previously there were different standard bodies located, so now to just combine them once, they have established this body known as National Standard Body of India, Bureau of Indian Standards, established under the BIS Act 2016 for the harmonious development of activities of standardization, marking and quality certification of goods, and for the matters connected therewith and incidental thereto. Okay, so ये किन चीज़ों के लिए है? This Bureau of Indian Standards would look after all the standardization of products, whether industrial, whether agricultural, whether food products. Okay, their certification, their quality assurance, all of these would be taken care of by this BIS. Okay, बाकी marks अभी भी exist करते हैं वैसे. Okay, so here I feel we can end the session for today, guys. If you want me to continue, I can continue with the further one, which we have some one or two important eminent personalities in public health, and then some of the epidemiology part. So if you wish me to continue, I can. Otherwise we can continue it in the next session if you are exhausted or tired. Right, so let me know in the chat box, please. Let me know in the chat box. So I'll wait for 10 more seconds. Please let me know, otherwise I'll end the session for today. I'll wind up. So I hope this session has helped you revise all these important things. And here we end with all our national health programs and agencies in India. Okay, so one or two people. Okay, continue. Great, then I'll continue for like 15 minutes more only. Okay, because all of you would be exhausted and tired. So I'll continue with the maximum I can cover in these 15 minutes. Okay, now moving to these important personalities that we have. The first eminent personality, ये जो बंदा दिख रहा है, okay, the Englishman that you can see over here, he is Edward Jenner. He is Sir Edward Jenner. Okay, so please remember, he is Sir Edward Jenner. Okay, he has coined the term vaccination. And he developed the first vaccine. याद रखना, Edward Jenner coined the term vaccination and he developed the first ever vaccine, and that vaccine was for your smallpox. So please remember, first vaccine was developed for which disease? That vaccine was developed for smallpox by Edward Jenner, and he also coined the term vaccination. Therefore Edward Jenner is known as father of vaccination. Father of vaccination किसे बोला जाता है? Edward Jenner को. Please remember, Edward Jenner is known as father of vaccination. ये father वाला भी concept clear कर लेना अभी. Okay, father of vaccination Edward Jenner, father of vaccination Edward Jenner. Okay, important. Can anybody tell me smallpox was eradicated on which date? WHO declared eradication of smallpox on which date? That date has been asked. Important one. Smallpox was eradicated on which date? Till that I'll cover this next eminent personality in white suit. He is sitting in the white coat. Okay, so please remember, he is James Lind. ये जो white में दिख रहा है ना, he is Mr. James Lind. He worked on scurvy and naval hygiene. Okay, there was observation that in mostly in sailors or those people who go on like merchant navy वगैरह, those people were at a risk of developing scurvy. Scurvy is due to which vitamin deficiency? Due to vitamin C deficiency. Ascorbic acid deficiency की वजह से होता है, right? So usually that was encountered. So he actually worked on scurvy. James Lind. So please remember, scurvy पे किसने काम किया था? James Lind ने काम किया था, right? So please remember this. Then moving further to next one. Before that, just tell me eradication date for smallpox. Yes, very good, right? It is 8th May 1980. Okay, so please remember 8th May 1980 smallpox was declared eradicated from the world. 8th May 1980 smallpox was declared eradicated from the world. 8th May 1980, याद रख लेना. It was the first vaccine developed. Now, a very very eminent personality from microbiology and public health, that is Sir Louis Pasteur. He is Mr. Louis Pasteur. He is Sir Louis Pasteur, याद रख लेना. He is the father of microbiology. He is considered the father of microbiology. Father of microbiology is Sir Louis Pasteur. He was a French microbiologist. ये क्यों French लिखा मैंने? Because once a question was asked that where did Sir Louis Pasteur die? So he died in France. Okay, so please remember, ऐसे याद रखना easy हो जाता है. He was a French microbiologist. Okay, he invented vaccines of CAR. कौन से वैक्सीन निकाले इन्होंने? CAR vaccines निकाले. What do we mean by CAR vaccines? C for cholera, A for anthrax, R for rabies. So the three vaccines which were invented by Sir Louis Pasteur were CAR. C for cholera, A for anthrax, R for rabies. C for cholera, A for anthrax, R for rabies. Okay, so please remember. Can anybody tell me who discovered the Vibrio cholera bacteria? Who discovered the Vibrio cholera bacteria? ये confusion होता है. याद रखना, cholera vaccine was invented by Sir Louis Pasteur, but he did not discover Vibrio cholera bacteria. Vibrio cholera bacteria was discovered by some other scientist. What was his name? Can anybody tell me? Vibrio cholera. So please remember, three vaccines: cholera, anthrax, rabies. Moving further, उनके और भी achievements हैं. He also invented the method of pasteurization. He also invented the method of pasteurization, which was named after his surname. Okay, pasteurization, technique to purify milk, right? Flash method होती है. Okay, so please remember, he also invented the method of pasteurization. He disapproved the theory of spontaneous generation of disease given by Aristotle. So सबसे पहले disease के लिए theory किसने दी थी? Aristotle ने, who was a philosopher. So Aristotle the philosopher gave the theory that disease ऐसे ही हो जाता है without any cause. Okay, so there is no known cause, theory of spontaneous generation of disease, but that was disapproved. Okay, Sir Louis Pasteur ने बोला ऐसा कुछ नहीं है. He disapproved the theory of spontaneous generation of disease and he gave his theory of germ theory. He gave the theory known as germ theory of disease. उन्होंने कौन सी theory दी? Germ theory of disease, that every disease would have some or the other microbiological cause behind it. Okay, germ theory of disease. No, guys, you're getting confused. So please remember, Vibrio cholera was discovered by Robert Koch. याद रख लेना, Robert Koch, who discovered Mycobacterium TB also. So Mycobacterium tuberculosis and Vibrio cholera, both bacteria were discovered by Robert Koch, and therefore is known as father of bacteriology. Okay, याद रख लेना ये. Germ theory of disease was given by Sir Louis Pasteur. याद रखना. Moving further to the next one. And this eminent personality that we have, a stylish looking personality with a long overcoat, that is Jon Snow. कौन है ये? Jon Snow है. Please remember, he is Jon Snow. Okay, Jon Snow is known as father of epidemiology. Jon Snow is known as father of epidemiology. He is also known as father of modern epidemiology. So father of epidemiology and father of modern epidemiology, एक ही personality है, that is Jon Snow. Okay, he worked on which disease? We have discussed earlier. He did some epidemiological studies on a disease, that is cholera. He worked on cholera, therefore cholera is regarded as father of public health. Cholera को क्या बोला जाता है? Cholera is regarded as father of public health. Important, right? Now, the National Institute for Epidemiology. The National Institute of Epidemiology in India is located in Chennai. Okay, the National Institute of Epidemiology in India is located in the city of Chennai. Please remember this. Okay, important one. Okay, I hope ये अच्छे से याद रख रहे हो तो. Now moving further, this is your epidemiology. Okay, some important points about epidemiology. Okay, so these are the three important things that you need to remember: epidemiological triad, epidemiological triangle and advanced epidemiological triangle. Okay, याद रख लेना, images आ सकती है इसलिए बता रहा हूँ. Okay, please remember the epidemiological triad. Sorry, just a minute. The epidemiological triad, guys, usually consists of three things. First is the host, okay, second is the environment and third is the causative agent. Right, three things in epidemiological triad कौन से है? The host जिनमें disease हो रहा है, the agent which is causing the disease and the environmental conditions around, like the temperature, humidity, altitude, right, radiation, pollution, water, milk, सब कुछ. Okay, please remember. And the agent can be either biological agent like bacteria, viruses, fungi, okay, chemical, physical, nutritional agents, any agent can be there. Next one is your epidemiological triangle. So इसको थोड़ा modify किया गया and that was now known as your epidemiological triangle. So this epidemiological triangle, it has the host, it has the agent and it has the environment. So what was added? So in the middle of the triangle, time was added. So all of these in relation to time, all of these in relation to time, that constitutes a epidemiological triangle. So host, environment and agent in relation to time would be known as a epidemiological triangle. Okay, which has four components. Then came the advanced epidemiological triangle, in which host was kept the same. Okay, agent was replaced with causative factors, because there can be variety of causative factors, not only these four types of agents. Along with that, environmental factors के साथ nutritional, genetic and psychological factors was also added, and in between time remained the same. Right, that was your advanced epidemiological triangle. Now there are some theories जिसके तुम्हें images आ सकते हैं, जिसके images पूछे जा सकते हैं. So please remember, first is your web of causation theory. Web of causation theory. Okay, so what do we mean by this web of causation theory? So for example, to cause a disease like stroke, okay, to cause a disease like stroke, there are various other causes, those are related to each other, right? So for example, for causing strokes, hypertension is a risk factor. For hypertension, obesity is a risk factor. For that, some genetic factors are also responsible. For that, decreased physical activity is a risk factor. For that, increasing cholesterol is a risk factor. So all of these are interconnected to each other. That leads to a formation of web. Okay, this is known as your web of causation theory, given by McMahon and Pugh. This web of causation theory was given by McMahon and Pugh. Web of causation theory, McMahon and Pugh. Web of causation theory, McMahon and Pugh. Next is your multifactorial causation theory. Okay, multifactorial मतलब बहुत सारे factors are responsible. Okay, बहुत सारे factors. Multifactorial causation theory, to cause a disease there are various factors which are responsible. So this multifactorial causation theory was given by Patton-Coffer. Multifactorial causation theory was given by Patton-Coffer. Multifactorial causation theory was given by Patton-Coffer. याद रख लेना. Next is your iceberg phenomena. Okay, next is your iceberg phenomena. So ये iceberg phenomena के बारे में दो बार क्वेश्चन पूछा गया है, so important है, याद रख लेना. Okay, this image जो है that shows you the iceberg phenomena of COVID-19. इसका मतलब है COVID-19 shows iceberg phenomena. याद रख लेना. Okay, there are many diseases which shows the iceberg phenomena. So क्या मतलब होता है iceberg का? Iceberg क्या होता है? It is a huge glacier जिसका बहुत ज़्यादा पार्ट, okay, बहुत बड़ा पार्ट is submerged under the sea or the ocean, और उसका एक छोटा सा पार्ट is visible on the surface. Okay, a very small part of this glacier is visible on the surface. Okay, that is known as the iceberg. Right, important. So this visible part, it is suggestive of what? This visible part is actually telling us about the diagnosed cases of any disease, like diagnosed cases of COVID-19 in this case, right? Whereas this submerged part, okay, जो छुपा हुआ part है, this invisible part, it tells us about all the misdiagnosed cases, the wrongly diagnosed ones, the undiagnosed cases which are not diagnosed, the subclinical cases which shows less symptoms, the asymptomatic or pre-symptomatic cases, and lastly the susceptible population. So बहुत सारी ऐसी population होती है who is devoid of diagnosis and treatment because they do not show symptoms or they are misdiagnosed, right? So this is actually an iceberg. Okay, many of the diseases like tuberculosis, okay, AIDS, COVID-19, many diseases, almost all of them shows iceberg phenomena. Okay, Rutemera is the mnemonic. So RU goes for rubella. Okay, so rubella TE goes for tetanus, ME goes for measles, and RA goes for rabies. So these 4 diseases, they do not show iceberg phenomena. याद रखना, these 4 diseases, they do not show iceberg phenomena. क्यों? So याद रखना, whenever these diseases would occur in any individual, they will 100% of time show symptoms. 100% of times they will show symptoms. Okay, so therefore all of them would be these visible cases. There would be no invisible cases for these 4 diseases. That is rutemera, rubella, tetanus, measles, rabies. Rubella, tetanus, measles, rabies. याद रख लेना. Right? Moving further, this is the scale. इस scale पे क्या दिख रहा है तुम्हें? This scale shows you the lead time. इस scale पे क्या दिख रहा है तुम्हें? Lead time. So let's see what are the different ones. Okay, so what you can say over here? So this line shows you the SARS-CoV-2 COVID-19 infection. Okay, somebody has the SARS-CoV infection over here. Okay, they have got the infection over here, but now the person has got the symptoms usually over here. Okay, so the persons have got the symptoms usually over here, somewhere over here, but like the symptoms become predominant at this part of time. Okay, the symptoms become predominant at this part of time. Therefore, the patient can be detected from the symptoms only at this point, right? Though the infection was acquired quite earlier, then also the patient was not diagnosed because the symptoms were not predominant. Therefore, whenever the symptoms will become predominant, then and then only the patient can be diagnosed properly, right? So this is the usual time of diagnosis. But what can be done if we run actually different various screening tests in this individual somewhere at this point of time? Then the disease can be diagnosed a bit earlier, and that can help us treat the patient much better, right? And that will have a very good prognosis. So this time gap which is there, the time which are we getting over here, the extra time in hands that we are getting to treat a patient or to diagnose a patient, that is known as your lead time. That is known as your lead time. Please remember this, okay? So that will lead to a better prognosis in these cases, right? Yaad rakhna. So I feel with this I can end the session, because now we have studies, and it is always better all the epidemiological studies are to be studied together itself, the analytical ones. So बस epidemiology में studies बचे, and then we'll move on to contraception. I'll include some more points of epidemiology in the studies itself in the next session. Okay, I hope all of you have enjoyed the session. Let me know if any issues that you would face, and let's meet in the next session. Thank you so much guys, and good night, take care.